Hello, I'm Mabel Jong with the World Healthcare Congress Interview Zone, and I'm very pleased to welcome to the chair today Dheeraj Batra, who is with Arogya Finance. Thank you so much for your time today.
Thank you for having me.
Well, it's very exciting that the sort of innovation summit that you were able to attend this past weekend. Tell me about the projects that you're involved with and how significant is it in the healthcare sector now?
Sure. So India is a place where not too many people have healthcare insurance. So the healthcare insurance penetration is somewhere around 15% or 20%, depending on what you go by. So the majority of the people then end up paying out of pocket. And India being India, it's only a small minority of that remaining can pay out of pocket.
Right.
So the majority of them end up borrowing, they sell what they have, or they just end up going without care altogether.
Right.
So what we do is we lend money to those people.
Okay.
And a lot of those people, just given the nature of who they are outside the formal system. So these are people who don't have collateral, who don't have credit histories, who don't have those formal mechanisms whereby a bank would be able to lend to them.
Okay.
So what we've done is developed our own way of figuring out who we can lend to and who we can't.
Okay.
So it's a behavioral-led algorithm which we've developed.
Okay.
So what we do is we put somebody through a series of these tests that tells us whether we should lend to them or not. And that's what we've been doing for the last 3 years.
Well, let me ask you, who is in charge of the pricing of certain services or certain visitations that they may have for physicians? How do you come with the value of that, and how do you know what to lend?
Okay, sure, that's a great question. So what we do is we partner with different hospitals and different, what are in India called nursing homes. And when they get somebody who can't afford to pay for the healthcare expenses, then they're referred to us. So we don't do anything with the pricing. We don't do anything with what type of care is administered or prescribed. We're there just to finance this. So we let the doctor, the hospital, the system that currently exists do all of that. We specialize in just providing the financing the person needs so they can actually get the care they need.
And who finances you? Do you have investors that invest in Arogya Finance?
So we're speaking with some investors and some foundations. Thus far, we've been financed by the founders and by a strategic partnership that we have with one of the largest medical device companies in the world.
Okay. Why would this type of lending be interesting to the global marketplace that is looking for innovative projects to invest in?
So if you look at the world, if you look at the worldwide picture, I would say the majority of the people are probably uninsured. Even the U.S. now with Obamacare, more and more people are getting insurance. But even in the U.S. until now, a lot of people were uninsured. Faced with that, and you take the world, most emerging market is probably uninsured. You talk to these people, you ask them about insurance, you offer to sell them insurance, and what they'll say to you is thanks, but no thanks. Why would I want to spend money on something which I may never need? Or what they tell you is, look, I live hand to mouth. I barely have enough for my family. If I have any extra money, I'd rather spend it on getting a better education for my child, or buying a better home, or honestly even a cell phone, than paying for healthcare insurance.
Of course.
So as it happens, healthcare insurance may not be the right product for some people, especially if you want to sell it directly to them. If it's subsidized by the government, it's one thing. So for people like that, they need some sort of stopgap when they're faced with an expense like that.
And you are lending.
We are lending
the funds.
Yeah.
What is the payback rate?
So right now we're able to get back about 98% of everything we lend, which is pretty good. From global benchmarks, it's actually competitive to the sort of the best numbers you'll see out there. And just to give you an idea, the scale of the problem is so large that unexpected health shocks, as they're called, are the number one cause of poverty worldwide.
Explain that.
So in India alone, each year, about 30 to 40 million people are pushed below the poverty line because of unplanned health expenditures. So what happens is, imagine, an uncle or an aunt one day just has a heart attack. You go in and you're on the hook for so much money to try to save that person's life. At that point, you'll do whatever it takes. You'll sell everything you have. You'll take loans which you shouldn't be taking because the interest rate's too high. And what that does is that ends up pushing all these people into poverty. It's a number one cause in India. It's a number one cause in the world, actually. So as the world is trying to say, let's pull these people up out of poverty, health shocks alone are pushing them back into poverty. So it's something that needs to be combated.
Now, how how quickly is an operation like yours growing? Because the need sounds so great.
The need is humongous. And I think what we're trying to do now is figure out creative ways to grow. Because we want to be sustainable, we're speaking with foundations, we're speaking with government bodies, we're speaking with corporate partners. We're trying to bring as many resources as we can to bear. Because it's not an issue of demand. The demand is out there. There's so many people who could use this. It's how quickly we can grow and supply it, like you're saying.
And what is the reception like so far?
It's getting better. You know, I think there'll be some dance that we'll have to do. We'll have to bring the right players together, right? Because this is too new a concept. Because what we do is we base our decision on your behavior. Right? You look at the finance industry, what normally they base it on are numbers, our data. And this is behavior, so it's the exact opposite way of looking at it. So for the finance industry, it's actually too new an approach to really get behind right away. So we need some people, some stakeholders in the middle that can help us close that gap.
Okay.
And that's where these government guys and these grand institutions come in. We've started conversations with them. It takes its time, but hopefully we can get it done sooner than later.
What's the silver lining so far that you've seen?
What do you mean?
The good news? What is the good news that you see on the horizon?
So most of the loans that we're making are right now for life-saving instances, which feels very good, right? Because I mean, a lot of people, as you can imagine, in this segment of the population, you don't have insurance, you don't have enough money, you wait until the very last second to get care. So a lot of people are literally coming to the hospital at the last possible second.
Of course.
So you either make a decision, give them a loan, or you don't. And if you do, then it's great because you're saving a life.
So are people who work for your operation on call 24/7 because catastrophes happen round the clock?
Yeah, and they understand that, so they signed up for that. So yeah, they definitely are.
All right.
They definitely are.
Dheeraj, thank you so much.
Thank you very much.
We really look forward to hearing much more about what you're doing.
Thank you.
Thank you. And I'm Mabel Zhang. Thanks for watching.